So Melanie Mitchell, thank you so much for joining us for this year's New Wave of AI in Healthcare conference. It's really an honor to have you. You're of course a thought leader of the whole AI space. You were and are at the cutting edge of AI throughout your career. So it's really great to have you here.
Well, thank you. Thank you so much for having me.
Hope you're enjoying it. So on the larger, broader scale, of course, the world is changing. If you look forward, maybe just 5 or 10 years, what are you most excited about? Maybe concerned, but where do you think we're all going?
Well, it's hard to predict, and we know that the history of AI has been filled with predictions that never came true. But, I think there are a lot of trends that I can see in AI. It's going to transform science and medicine. I do believe that. And I think that that's going to be really the biggest transformational area of AI, in fact, much more than in any other area. And I think that we are going to have systems that are kind of co-pilots, if you will, or assistants that are going to help us enrich our abilities to understand data, to understand very complex systems, and to augment us, not replace us, but augment us in our scientific and medical research and progress.
Mm-hmm. Well, it's a beautiful vision, and we should for sure work towards it. But maybe more on the complexity side. So especially if you think about biology and healthcare, so in the areas where the data is not generated by humans, like language, but by nature and physics, there's of course so much more complexity than actually in our human language. So it's inconceivable that a human brain could ever conceive all the complex interactions in a single cell, let alone in a patient, in a human being. Yet we can build even more complex systems that can be very useful in practice. For example, predict response to treatment or outcome. And we might be able to even prove that they are safe and effective and equitable, but we probably won't be able to understand it. So explainability very soon for us humans will be out of the window. How do you think that's going to play out?
Yeah, that's a very interesting question. I mean, I do hope that AI systems will, in some sense, be explainable. I don't think they'll be completely explainable because, as you say, they themselves are very complex systems, and they're being used to help us make sense of the data from very complex systems. But we have in the past figured out ways to understand complexity at a more conceptual level. We can't make very detailed predictions, but we can often make very useful, more coarse-grained predictions. And I think the same thing will happen with AI, that it will help in allowing us to better conceptualize what's going on in these very complex systems. It's something that's a big open research question, how to do that, but I do think we will make progress on it.
Yes. So one thing that actually worries me a lot is that because of a lot of misunderstanding, fear, skepticism, we might actually get into a realm where progress in AI is slowed down, which would be actually detrimental in healthcare, for example. If we would have tools that would save lives and we don't use them, I think that could be even stated as unmoral to actually not use them, right? Yet there are, of course, many of our colleagues or many representatives of popular opinions who think we should hold off, right? Who even think AI could be an existential risk to humankind. So where do you think these sentiments come from, and do you think they will really take over and put us back in the Middle Ages where we don't have the tool to care for our patients?
I hope not. I think, that people often fear technologies that they don't understand. This has been going on since the beginning of technology, right? And that we tend to, in some sense, misunderstand sort of the nature of intelligence, I think. And that's one of the reasons that people have sort of these big fears about AI systems that may not be valid. You know, I think there are valid fears about AI systems. People can definitely misuse them in many ways, just like any complex technology. So we have to balance those possible harms with the benefits that we can get from these technologies, and that's going to be a hard thing to do. So, you know, our governments are struggling with this kind of regulation now, and I think, you know, medical ethics boards and so on are going to likewise struggle with how these systems should be used. But it's, as you say, it's going to be a huge loss if we don't use these kinds of tools in medicine and healthcare, because they do have the potential to really bring a lot of benefits. You know, one thing I think will help was what we just talked about, which is explainability, interpretability. I think many people are wary of these tools being sort of black boxes, and they make predictions, and maybe their predictions are very good most of the time, but we don't understand why they make them or when they're going to make errors. So I think that sort of the science of AI itself giving rise to better understanding and explanation methods is going to help in the adoption of these tools.
Great. So thank you so much. I hope your voice is going to be heard loud and clear for everyone. It really paints a very nice picture about where we should go, where the field should go, and how we can really maybe lessen suffering in the world with AI, and it would be a beautiful thing.
Great. Thank you very much.
Thank you.